I think the key problems that our industry faces is the lack of regulation. Today, the government hasn't created any barriers of entry for any player to enter into the pathology or the diagnostics industry. Anybody can start a pathology lab. All you need is a Shop and Establishment Act by the BMC, and you can start a laboratory. Because of this, you've seen a lot of fly-by-night operators come into the market, create a lot of price competition, and worse than anything, create sort of lack of standards. One bad apple creates sort of tarnishes the entire industry, and I think that's been a big problem for us. Consumers have a hard time distinguishing between who can be relied upon and who cannot, and I think that's a constant quest of ours to keep proving that we are a step above other diagnostic chains, and I think that's probably one of the bigger issues that plagues the industry. The other thing is that today we are expected to sort of run international level quality with accreditations, like CAP and NABL, which are all international accreditations, but we function at 1/10th price that a country like the US functions at. If they are selling a price for $10, we sell the same thing for $1. So it's quite difficult, but we use the same kind of systems, we use the same reagents, we use the same processes. So I think we started looking at it quite positively and telling ourselves that we must have developed a skill set that's quite important, that we are functioning at international level quality with Indian price. So I think these are probably a couple of the things which are quite difficult for the industry. We try to do from our side is to constantly, as I mentioned, innovate ourselves on services and on convenience for consumers. We make sure that the experience for the patient is flawless from the time they enter to the time they leave. The report is on time, their experience is as painless as possible. When they're interacting with our staff, they're made to feel comfortable. We don't like creating an atmosphere like a hospital, which is a very serious atmosphere. We like making it more like a hotel, where somebody can come and try and get a little bit more relaxed. It's more of a hospitality-based sort of outlook that we have. The other thing we do is we innovate on technology, as I mentioned, and we innovate on quality. We make sure that every time we are creating awareness amongst the patients and amongst the doctors, that how we are better than everybody else, what is the latest technology we are using, what are the better processes we are using. And this is the way we try and explain to people why cost does not need to be the main factor in really deciding when a prescription is to be written, where the patient should go. The decision, at least in healthcare, should be based on services and quality and not on price. We're the first healthcare company in India to use SAP as a way to go forward. I don't think there's been any other healthcare company which has done this so far. Of course, abroad, globally, there are quite a few. So we've implemented that in Bombay. We're rolling it out to all the other locations. I think by the end of the year, we'll have it in 5 locations across the country. This is obviously helping us with a lot of real-time information, a lot of data transfer without any manual issues. And it will go on to help our patients in the way of, we are already providing web reporting facilities where patients can log on to our websites and download reports whenever they want. It's not something which has to be done manually anymore. They don't have to come and physically pick up the report. We are also introducing a new feature where they can log on to our website and actually track the sample. So if they've given the sample at 8 o'clock in the morning, they can actually log on to the website and see where exactly the sample is at 2 o'clock in the afternoon and what time the report will be ready. If there's a delay, it is automatically told to them through SMS. Look, don't come and pick up the report right now. Please come 1 hour later because of this reason. So I think technology has helped us bring convenience to consumers, where today everything does not have to be done through a physical route, which I think is very useful. Obviously, Bombay is a bustling city. It's not so easy to get around from one place to the other. So we've done this across the country. We pick up samples from Guwahati, we get them processed in Chennai. Pick up samples from Kanyakumari, get them processed in Delhi. And obviously, it doesn't have to be a two-way street. The samples have to travel in one direction and data can flow in the other. So I think these have been quite handy for us from a consumer standpoint. From an internal standpoint, obviously, it's made our systems better. Our data is cleaner, a little bit more accurate. And I think we're looking forward to using these things to sort of take to customers in the future as well. I think it's going to play a big differentiator, and I think it's not only in the future, even today it is. Recently we tied up with a leading insurance company where they were looking for a company, a diagnostic chain, where they wanted a partner who was going to pick up samples from 400 centers across the country, bring it to one location, which is Bombay, do the testing of samples, and then on a daily basis send out the results to all 400 centers and upload it to their website. When we went and applied for this contract, we were obviously in competition with 2 or 3 of our competitors, and the reason we won it was because of technology. We had an electronic data system which allowed us to bring in that data, from 400 locations into one location and send it back out and do a daily dump onto this insurance company's website. This ability to do it on a day-to-day basis obviously came from the fact that we have the same system rolled out across 400 centers, which made it very useful for us going forward. A lot of our competition does not use the same IT system across their centers. They have different systems in different locations. So obviously when you don't have a common infrastructure, common technology infrastructure, this is not possible. So we already found it being very useful in some of the contracts that we've won, and I think going forward, when we work with larger corporates, we work with larger insurance companies, this is going to be the way forward. Health insurance is going to be one of the biggest drivers in our business. As we go forward, today our people are paying out of pocket. Tomorrow everybody is going to pay through health insurance, even for diagnostics. And obviously the insurance companies will want to tie up with chains which have got standardized infrastructure, which includes technology and automation across the country. So I think it's going to be a huge differentiator. Tough one. I think it really depends on the industry. I think our industry has really not used it strategically so far. Ours is a very fragmented industry. If you look across the country, there are 50,000 laboratories. And if you look at the market size, the top 4 chains, including Metropolis, are probably less than 10%, hold less than 10% market share of the entire industry. So that's how fragmented it is. I think going forward, once this market consolidates further, that's where technology will play obviously a bigger role, because each company will have a bigger network, bigger number of centers. Today we are present in 4 countries. Hopefully tomorrow we'll be there in 10. And technology is obviously going to be the key thing that connects all of us. When samples move from South Africa or Middle East to India, the reports obviously cannot go through hard copy. They need to go through a seamless data transfer. So I think going forward, this will become a much bigger, facet of our industry and a bigger facet of our running businesses. So far, I wouldn't say it's been used very strategically from an IT standpoint. From a technology standpoint, obviously, our machines and our automation has been very key. One of the new systems that we're going in from an equipment standpoint is what we call as a Streamlab system, which is a pre-analytical system, where it's like a factory setting, where samples can be just put into a conveyor belt, and they move from machine to machine to machine, and everything just gets done automatically. There is absolutely no manual intervention at all. We are just starting using the system this month in Bombay, and we're going to then introduce it in Chennai. So I think technology has been a big part of it. IT, of course, is a different situation. We are very heavily reliant on IT as a company because everything goes through our laboratory information management system. If the information system is down, everything comes to a standstill. We need a pretty robust IT team who understands the software, who understands the hardware, and who is able to provide the service support to keep it running 24 hours a day as required. Needs to understand keeping the backup of data. But we also require an IT team which is quite strong on processes and documentations. We work a lot with pharmaceutical companies and with the clinical research organizations, where in clinical research documentation is extremely important. It's very, you have to make sure that there is an audit trail for everything. You have to make sure there is a security hierarchy for everything. So I think IT there plays a very important role in making sure that we are moving towards HIPAA compliance. We are moving towards CLIA compliance, and these are all very important accreditations and standards in the IT and in laboratory systems, where we are constantly ahead of the game in terms of technology infrastructure. So I think the weightage and the dependence is very high. What we would expect from them going forward is to keep innovating, keep finding new services and new conveniences for consumers to make it easier for any of our customers to access our data as required, to obviously keep improving our internal processes and systems to make them more robust and stronger, to weed out any loopholes which may be there, and to keep improving the documentation and processes. I think going forward, IT will have to be that differentiator role between us and the competition. So we are quite heavily relied on the IT team. That's pretty much true for every division in every company. Everybody wants a higher budget, and you've got to make sure that you're controlling it to manage the entire budget of the company. We've looked at IT being an important role, so we've put aside about almost 5% of our revenues towards IT budgets on a yearly basis. So we're putting aside quite a large amount of our revenues towards an IT system and processes. We spent almost $1 million in the last 2 years to put in place the SAP and the LIMS system across all our locations. It's a tug of war, and you've just got to make sure that you understand the importance of IT, while obviously making sure that you're getting your best bang for your buck. And that's where I guess the teams, the finance teams and the IT teams have to work together to negotiate the best, find the best vendors,